In terms of radiosurgery, this is called radiosurgery because it's a form of radiation that's given a very high dose to one spot. And the spot could be 4 millimeters or 1 centimeter or 2 centimeters. And this is limited to tumors in the brain that are less than 3 centimeters in size. Bigger than that is not recommendable. It could be used for metastatic brain tumor, somebody that had cancer travel to the brain that in the past we will have to open the head, remove the tumor. When we have a diagnosis, it's easy with gamma knife or other types of radiosurgery to simply zap that, and treatment that takes 1 hour and the patient go home and be home the same day. Radiosurgery is also used for a condition called trigeminal neuralgia or a facial tic. It's a very severe pain that goes to the face and is caused by inflammation of a trigeminal nerve. That's the nerve that gives you the sensation of the face. That's a very debilitating disease. People take anti-epileptic drugs and many other drugs, and sometimes even with that, they have several crises. Every time they drink, every time wind hits your face, a crisis of pain can trigger. So the gamma knife could be used to zap that nerve in one session, and the person could be home again the same day. A stereotactic frame is placed to preserve very high accuracy, and that is put under local anesthesia and sedation, and the MRI is done with the frame on. The information is transferred to the gamma knife planning computer, and the same in an hour the procedure will be done. Other things that we can treat, tumors of the acoustic nerve or vestibular nerve that are usually benign, but as they grow, they will compress the brainstem. And gamma knife could be used to treat the tumors that are less than 2.5 centimeters with tumor control over 90%. In the past, we will have to open the patient head. Most people will lose the facial nerve or the hearing or both. If patients have hearing preservation or they still have hearing function, this is the best result with a minimal invasion. Tumors that are bigger than 3 centimeters obviously would require surgery, but sometimes a combination of surgery with gamma knife is an option for patients to decrease their risk to lose their facial nerve. Other pathologies that could be treated with gamma knife or radiosurgery is arteriovenous malformations. Smaller arteriovenous malformation could be treated without the risk of doing an open surgery. The result of this is slow, very effective, and have very low risk, except for the actual risk of rupture of the arteriovenous malformation. Meningiomas and other tumors could be treated with radiosurgery, and there is also a functional treatment with radiosurgery, including for Parkinson's disease, seizure disorders, obsessive compulsive disorders. These are more in a research phase, and they're not done commonly today, but it's an option for radiosurgery. At Center for Neurosurgery Institute, it's our privilege to serve the community. We have a very successful group of neurosurgeons, physician assistants, and doctors, as well as the staff that's ready and happy to serve our community. We receive patients from extended areas, including international patients, but in addition to that, we are very happy to have the best results in the community.